Okay, hello everyone. So, welcome you all to my YouTube channel Ashish Coding. Today's topic is CPC exam update for 2022. So, there is a big update coming from the AAPC USA regarding your CPC certification exam. So, I am going to cover all these updates and everything under this video. So, please subscribe to my YouTube channel and so that you will get next update on timely manner. So let's begin our today's presentation. What exactly the CPC exam and what is this new update, how it will impact the students who wants to appear for the CPC examination. So let's start our today's video. So the new update in this CPC exam 2022, the first update is this: the CPC exam now is a 100 marks examination. Previous years we all know that the CPC examination is around 150 marks exam. Now APC reduced 150 marks to 100 marks for this current 2022 exam. So the reduction in the mark of 50 in the new exam from the first those who are appear for the CPC examination in this 2022 effective from 1st Jan 2022. So currently the question pattern will be 100 MCQ questions, and this 100 MCQ question is break down into multiple subsections. So before I continue with the breakdown, I will explain you there is one more change in the timing as well. What is that change? Let's understand. So previous exam is total time duration will be 5 hours 40 minutes, but as per the new rule, the current exam time duration will be 4 hours only. So 100 marks question and the time duration is 4 hours. Again, it's a open book exam. So CPC exam is always open book exam. And what are the books that we use in this exam? So here is the book. So the books used for this examination is CPT book 2022 edition, ICD book 2022 edition, and HICPIC book of 2022 edition. So these are the three manuals are used in your CPC examination. These three manuals are approved by AMA and the CPC for the CPC exam perspective. So these are the three books that we use in this exam. Apart from that, let's now go deep dive into the breakdown of the questions in the CPC exam. So this 100 MCQ question is breakdown into different subsection. So the passing percentage for this CPC exam is the same, that is 70 percentile. So those who appear for the CPC exam, they need to complete the paper with a percentage score of 70 percentile. It means you need to secure 70 marks out of 100 to clear this CPC exam. And so the breakdown of this 100 MCQ is like this. The first section in the CPC exam is this surgery coding section. Again, this is very important section because total 36 mark is assigned to this surgery coding section. And the breakdown of this 36 mark will be in 1 series to 6 series. So 1 series, that is the series for integumentary system and dermatological surgery coding, it is for 6 marks. 6 mark and 6 question is for 1 series. Again, 2 series which is for orthopedic surgery and musculoskeletal surgery coding. The total questions for this series is 6 questions for 6 marks. The next series will be the 3 series. The series for cardiovascular surgery coding plus respiratory surgery coding. The total marks for this 3 series section will be 6 marks for 6 questions. And the next series will be the 4 series. It includes the gastrointestinal surgery, urinary tract system surgery coding. And the total questions for this 4 series will be 6 questions for 6 marks. The next series is 5 series. 5 series, and the total questions for 5 series is 6 questions for 6 marks. And the last one is the 6 series, which is the surgery coding for the eye and ear. So all these 6 series is for 6 marks and 6 question is assigned to 6 series. So if you check, the total marks for the surgery coding section will be around 36 marks. in your CPC examination. So this is the first change. Previously the total mark for surgery coding was 60 mark. Now the current, as per current 2022 update, the CPC surgery coding section itself is only for 36 mark. So next section is again the very important section, that is evolution and management coding. The total question for this E&M section will be 6 questions for 6 marks. So previously this particular section is for 10 marks. So the AAPC reduced 4 marks from this section to condense the CPC exam into the 100 MCQ question. So 6 mark is assigned to the E&M coding section in your 100 MCQ CPC examination. So after the evolution and management, the next section will be the anesthesia coding, and the total mark for this anesthesia coding section is 4 questions for 4 marks. The next section after anesthesia coding will be the radiologic coding, and the total questions for this particular section is a 6 questions for 6 marks. So again there is a reduction in the radiology plus anesthesiology total questions count in order to condense the exam in the 100 MCQ pattern. So next, after the radiologic coding, the next section will be the lab and pathology coding. So in this section, the total marks is 6 and the question size is 6 questions for 6 marks in this lab and pathology section. After the lab and pathology section, the next section will be medicine section. So total mark for this section is 6 and the questions is size is 6 questions for 6 marks in this medicine section. After the medicine section, the next section will be your medical terminology, and the medical terminology is for 4 questions for 4 marks. So only 4 questions is for your medical terminology section. Previously it will be the marks will be more and the question is also more, but now the pattern is changed. So only 4 marks is allocated to medical terminology. After the medical terminology, the next will be your anatomy related, human anatomy and physiology related questions. The total questions, around 4 questions is assigned to this section, and the total marks for this section will be the 4 marks for your anatomy. After the anatomy, the most important part is your diagnosis coding, ICD-10-CM diagnosis coding. The total marks for this section will be 5 marks is only for this ICD-10 diagnosis coding. So after the ICD-10 diagnosis coding, the next section will be the HCPC, that is Healthcare Common Procedure Coding System question. Only 3 questions is assigned to this HCPCS coding and 3 marks is allocated to these 3 questions. After the HCPC coding, the next section will be your compliance and regulatory. So all the regulatory and compliance related guidelines like LCD guideline, MCD guideline, CMS 1500, UB04 related questions, all those compliance and regulatory question is assigned with the 3 questions and 3 marks is assigned to this particular section. The new pattern in this CPC exam 2022 is this 10 case study. These are the case studies from real life coding cases scenario. So you will get a multiple case studies of different specialty, which is the real time case studies of coding scenarios. You need to check that record and you need to check those case studies and assign the proper CPT and diagnosis code based on the specialty, based on the question, that based on the scenario that is asked in that particular case study. Sometimes you will get the case studies related to radiologic coding. So you will have the patient name, date of birth, or the procedure performed. Under that there is a description and the impression and finding, like that the pattern will be there. So you need to check what exactly the CPT, which is the procedure performed, and according to that you just put the correct CPT code by referring your CPT book based on the specialty, and then you need to assign the proper diagnosis code plus the modifiers with that particular scenario. So 10 questions, 10 for 10 case studies, and all these 10 case study is real-time coding scenarios. This is the only change in the upcoming exam. Previously there will be no case studies, this type of questions in the last exam, previous year's exam, but in 2022 this is the new latest update in your paper pattern, that it will come with the 10 real-time real life scenario of the coding cases. So collectively, if you check the total questions for this CPC exam 2022 will be 100 MCQ questions. The best part of it is that there is no negative marking for this CPC exam. So you need to secure the 70 percentile, that is the 70 marks to clear this CPC examination. So that's it, is the update from CPC exam 2022. For your understanding purpose and for your reference purpose, I will give you this mind map for free in the description below. So download your this mind map and PDF in this description below of this video and refer it. And I wish you all the best to all those who are appear for CPC exam 2022. If you want to learn this CPC examination syllabus, or if you want to learn advanced medical coding CPC certification program, then click on the link below which is in the description box and watch my 30-minute presentation about this examination, so that it will give you enough pointers about the new pattern and the career opportunities in the medical coding. So that's it in this today's video. Thank you so much for watching. Make sure you subscribe, like and hit the bell icon at the right side. Thank you so much. This is your friend Ashish. Have a good day. Bye bye.